Welcome back, everybody. Watching CNN Newsroom. I'm John Vors. In Italy, there were hopes that maybe the coronavirus had peaked after 2 days of a falling death toll. But in the past 24 hours, the numbers once again surged, the government reporting 743 dead. The World Health Organization now confirms almost 64,000 cases in Italy, with more than 6,000 dead. The death toll also rising in the UK. The government reports 87 dead on Tuesday. The WHO puts Britain's overall death toll at 335, more than 6,600 confirmed cases. On Monday, Prime Minister Boris Johnson announced a strict new stay-at-home order, the tightest restrictions Britain has seen since the end of World War II. Well, doctors and nurses around the world are the ones on the front lines battling the coronavirus. But across Europe, medical personnel are becoming infected at an alarming rate. CNN's East Suarez reports on the dangers they're facing.
Overworked and overwhelmed,
help us.
These heroic medical staff in the UK are calling on Brits to stay home and help them help us.
We need to stay healthy so we can help you. You can help save our lives. Stay at home.
This as they confront war-like scenarios they never dreamed they would encounter.
We've had doctors tell us that they feel like lambs to the slaughter, that they feel like cannon fodder.
Across Europe, doctors and nurses are on the front lines battling the coronavirus, and a worrying statistic is emerging: the number of medical workers themselves who have become infected. In China, just under 4% of the cases reported through February 11th were healthcare workers. In Spain, it's over 10%, and Italy is not far behind. Nearly 4,000 National Health Service workers penned an article expressing concern that they don't have adequate protection. The NHS says it's stepping up deliveries of vital supplies. But it is in Italy where the crisis has been most acute.
Here in Italy, coronavirus first took hold in Europe. Many in the medical community were caught off guard by just how quickly and tenaciously the virus took hold. More than 20 Italian doctors have now died. Among them was Dr. Roberto Stella.
Roberto Stella was a friend of mine. Roberto Stella was a great, enthusiastic doctor.
Michele Leoni says he hopes his friend is remembered as someone who gave back, who started a program for high school students to learn about medicine. Dr. Angelo Pan is the head of infectious disease medicine at a hospital in Cremona.
Even a small error can give you the infection, and then you have to hope not to get any serious problem. It is quite scary, yes.
Dr. Pan says his hospital is well supplied. The pandemic came so quickly, though, that he did not have time to train his colleagues in infectious protocols. Patients are now being treated throughout the hospital.
Now I'm taking care of the patients in the orthopedic wards. They are not used to manage patients that have transmittable viral infections. I'm scared of the outbreak. I hope I will not die before the outbreak ends up.
The crisis hit Spain later than Italy, but the number of cases here has skyrocketed. One of the big problems we're seeing in hospitals like this one is a lack of protective equipment. The nursing union has even created an instructional video on how to fashion a waterproof gown out of garbage bags. She explains how to fold and tape the bag just so that it provides protection and fits. Do you feel safe at work? No, we don't feel completely safe, he says. You don't stop to think about it, or we wouldn't go in to see the patients, but we have to.
A lack of personal protective equipment is also a serious problem here in France, where the government's introduced some of the most stringent quarantine protocols in Europe. The first French doctor died this past weekend. Already now, at least 4 medical workers have died. I spoke with a lawyer who represents doctors suing the French government over the lack of equipment and masks in particular. French authorities have now ordered 250 million of them, but one of the doctors suing the government says it is far too late. He says authorities here are guilty of incompetence. The French government tells CNN they have no comment on the lawsuit.
If this virus had arrived in France, then okay, we would have been unprepared. We wouldn't know how it works. But we watched China for 3 months and Italy for 15 days. How could they have thought it was going to be different here? And the proof is that today we have exactly the same figures in terms of mortality.
As the number of cases in Europe continue to spike, it is these doctors and nurses who are selflessly putting their health as well as their lives on the line so that we can survive. Isa Suarez, London.